Hi, my name is Sochi Pareto, and today I will be informing you about what periodontal disease is, any risk factors, and any signs or symptoms that you should be looking out for, and how to treat and prevent it. So, what is periodontal disease? Periodontal disease is an infection of the tissues that hold your teeth in place. It is typically caused by poor brushing habits, no flossing, and those habits just allow the plaque to build up around your gum, which then can turn into hard plaque, which is called calculus. And that calculus is what really irritates your gums and really affects your bone health. So it starts with swollen, red, bleeding gums, and if left untreated, it can spread to the bones surrounding the gums, making it painful to chew, and in worst cases, teeth may become loose and need to be extracted. So, nearly half of adults worldwide have some form of periodontal disease, whether that is gingivitis or the severe periodontal disease cases that we see. But gingivitis is just that inflammation of the gums whenever you brush or floss, and just a light bleeding. Yet many adults don't realize that they have any form of periodontal disease or those severe cases until it gets irreversible, unfortunately. And it is important that we deal with these things in a timely manner because it is a growing global health condition and it affects oral function, quality of life, and it's linked to conditions like diabetes and heart disease. So I have researched a couple of credible dental resources, including the CDC, the NIDCR, and the Cleveland Clinic. I am trying to make you understand what periodontal disease is, its causes, symptoms, prevention strategies, and treatments, and it is essential because early awareness can prevent severe long-term overall health consequences. So, what are risk factors? Risk factors are dental plaque, which is that bacterial film that I was talking about. It can turn into the calculus. And then poor oral hygiene is another factor. Smoking, vaping, dipping, any sort of tobacco usage is also a factor for periodontal disease. Uncontrolled diabetes, genetic susceptibility, medications that reduce saliva, any dry mouth really helps that hard calculus form, which is what we don't want. So just make sure you're staying super hydrated. Any hormonal changes such as a pregnancy, puberty, or menopause for ladies, and then poor nutrition or just vitamin deficiencies in general. You just want to make sure you're getting in your vitamins and making sure that we're doing our best to prevent these things from happening. So, any signs and symptoms that you can look out for and that may indicate periodontal disease are red, swollen, bleeding gums, especially when you brush or floss, gum recession, which is just whenever your gum levels are a little lower than we would like them to be. They do make your teeth look longer, persistent bad breath or bad taste in your mouth, formation of deep periodontal pockets. So what we do are these perio charts, which is just a measurement of your gums, and those pockets just usually indicate some sort of bone loss or just that the gums aren't squeezing around the teeth like we usually like them to be. So that is another indication of periodontal disease. Any pain or discomfort when chewing, sleeping, or in severe cases, pus around the gums is another symptom. How to prevent it? You can brush twice a day and floss daily. I know it's really hard, but we can do it. Regular dental cleanings and checkups quit smoking and quit vaping, maintain controlled blood sugar levels and a balanced diet, and just making sure you stay hydrated so that you don't create those dry environments for that calculus to build up. Any treatment is scaling and root planing. That's just whenever they go under the gums and they clean really good. And any local or systemic antibiotics if needed. Periodontal surgery such as root grafting or flap surgery, which is just those flaps on the gums if they do become loose, or any ongoing periodontal maintenance every 3 to 4 months, just so that you can make sure your dentist or your hygienist are keeping an eye out on that and making sure that they're not getting any more severe and that we can get that under control. So that was my main topic for today. Thank you for listening to me. Periodontal disease is a really common disease. It's often silent and serious, and understanding what it is, what it causes, how to recognize symptoms, and how to prevent it is crucial for lifelong oral health. Thank you for listening.